This video is going to talk about cervical screening, which is sometimes called a smear test. It'll explain the test and why it's important. All women and people with a cervix between the ages of 25 and 64 will be invited for a smear test. It looks for a common virus called the human papillomavirus, or HPV. You can get HPV from any kind of sexual activity with a man or woman. Most people will get HPV at some time in their lives, and their immune system will clear it up with no problems. However, it can sometimes cause changes to cells that may develop into cervical cancer. Cervical screening is the best way to prevent cervical cancer. When you go for the screening, the nurse or doctor will usually be a female. However, you can ask for a woman when you make the booking. You'll be taken to a private room and asked to remove your underwear. You'll lie in a bed with your knees bent, and the nurse will use a speculum so she can see your cervix. A small brush will be used to take a sample of cells. It usually takes about a minute, and you can stop at any time if it's uncomfortable. After your sample has been tested, you will receive a letter or a phone call with the results. If your result is clear, you will be invited back in 5 years. If your result shows that you have HPV, then you'll be invited back in 1 year. If your result shows you have HPV and cell changes, then you will be invited for more tests. If you have any of these symptoms in between smear tests, then contact your GP. Bleeding when it's not your period. Bleeding after periods have stopped. Pain or bleeding during or after sex, or any unusual fluids from your vagina. If you have any concerns, then it's important to contact your GP.